Welcome to Medical Mondays. I'm Lisa Carberg. We are joined today by Dr. Wajahat Mihal. He is with Yale. He's a professor of medicine, digestive diseases, and director of Yale Weight Loss Program and Yale Fatty Liver Disease Program. Doctor, welcome and thanks for being with us.
Thank you for the invitation.
So, how does with all this eating with the holidays, what do we have to look out for our body's overall health?
Um, so, as usual, I think we just need to feel in contact with our bodies and just have an idea as to how our bodies feel. Of course, we all like delicious food and we all like to eat delicious food, but at the same time, just have a thought as to how our stomachs are feeling and how our bodies are feeling, and use that as a guide as well.
Doctor, we've been talking a lot about weight loss drugs,
Mhm,
GLP-1s, and a lot of people are getting very skinny. You see people and you don't
mhm,
even recognize them sometimes, but a lot of health benefits we're seeing as well
mhm.
from these, more discovered every week. So it's obviously a big trend in our country right now. Do people have to tweak anything going into the holidays, changing their medications, their doses? What are you telling people?
So people definitely should not change their medication dosages, go up or go down, etc. I mean, they're there on a regular schedule for a reason. However, if it's somebody's first Thanksgiving since they've started taking one of these medications, again, they should just, sort of just check in and see how they feel. Do they feel full? Particularly, are they having any symptoms of nausea, etc.? In general, of course, people will feel full much earlier if they're on these medications than if they were not on these medications.
Are they still able to eat as much as they wanted before?
So they will, since their appetite is reduced, in general, they will have a desire to eat a smaller amount of food. So they might feel that when they've eaten about half as much or three-quarters as much as they might have last year, they might feel full. And just some simple habits, such as you can always start off with less food on your plate and see how you feel at the end of that. Of course, we can all go back and get some more food. So just some simple steps like that, I think, can be helpful. But if it's somebody's first Thanksgiving on one of these weight loss drugs, they should just expect that they will feel full or, hopefully satisfied with smaller amount of food than they had last year.
And I guess a host should be wary of that or just be aware of it, I should say, that if someone isn't eating at your table, they might want to not tell everybody that they're on a drug like that. But if someone isn't eating as much, it's no offense to your cooking.
Right. So, I mean, obviously, food is an intimate part of our family lives and our social interactions, and people get all kinds of cues based on who's eating how much or not eating how much. And even apart from these medications, it's really always a good idea not to force food on people. I mean, you've given one reason why not to do that. Many family perhaps only see each other once a year, and other people may be struggling with eating disorders, etc., that you're not aware of. So it's really never a good idea to, I mean, maybe politely once you could mention it, but sometimes some people can be very repetitive and insistent about having seconds and thirds.
And what about you mentioned eating disorders? How common are they? Tell us about that.
So it's interesting. They're certainly common. I mean, they're certainly in the sort of 5 to 7% of the population, depending on exactly how you define an eating disorder. So they're not rare. And obviously, these are personal medical information that obviously there's no reason why anybody should share them, even with other family members. So I think one should just be sensitive to that. And even as a host, obviously, you've done, if you like, your job as a host by preparing a wonderful meal, but it's really one should avoid insisting on your guests to just have more and more food.
What do you tell your patients as you go into the holidays with all the food that's available? Your weight loss, your fatty liver, your a lot of important health touch points.
So, I mean, I think we just need to just use common sense. I mean, these are obviously special times. As I said, sometimes people only meet family members, once a year at this time. And clearly it's a time we should celebrate, and eating is a huge part of celebrating. So I don't think one should be too uptight about that. Just use some common sense, be in touch with how your body is feeling, and clearly, enjoy all the wonderful food that most of us are fortunate to have. And at the same time, it's more important to think about what our baseline is, meaning how are we keeping ourselves healthy for the rest of the year? And if we have a good baseline, if we have a good routine and are keeping ourselves healthy for the other times of the year, 2 or 3 days of indulgences is really not a health problem.
All right. And I want to mention Professor of Medicine, Digestive Diseases. This is your resume, Director of Yale Weight Loss Program and Director of Yale Fatty Liver Disease Program, just so we have that officially on the many areas that you touch on. All right. So, what about people in the kitchen? What about some dangers like food dangers, food safety, maybe choking? Do doctors see more of that in the emergency rooms? Tell me about that.
No, unfortunately, we do. I mean, so as a gastroenterologist, if someone has a food choking problem, it's called technically food impaction, then typically we're the people who are called to do an endoscopy and try and identify what's going on and hopefully extract it. And unfortunately, it is common that at this time of year, people are presenting to the emergency department with food impaction. Not surprisingly, this would be in individuals who might have trouble chewing. So anybody who has dentures or ill-fitting dentures or any other reason by which they cannot chew food properly, because we're all, having conversations and eating food fast and perhaps trying different things that we haven't tried before. Typically, it's in elderly people because obviously they're individuals who are more likely to have issues with dentures, etc. So we just need to be a little bit careful. And if there's a family member who is perhaps elderly and who perhaps has difficulty chewing, just be a little bit more careful about how the food is prepared. And if they're comfortable with you cutting the food for them on their plate and such like. But it is a reality, unfortunately, that, at a hospital the size of Yale New Haven Hospital, it would be unusual for Thanksgiving to pass without us having one or two instances of people coming in with food impaction.
All right, doctor. Our next segment will be coming up in just a minute. Dr. Wajat Mihal with Yale Medicine, thank you for being back with us again. You have so many important specialties of weight loss, fatty liver disease. Let's talk about alcohol and the holidays. They seem to go hand in hand, and unfortunately, a lot of people like to indulge.
Yes, so of course, as we were speaking earlier, I mean, alcohol is part of food and is part of celebration. And what goes in terms of keeping an eye on our bodies um, in terms of what we eat goes doubly for alcohol. So really, it's just a lot of it is common sense. And similarly, as there are some people who have issues with eating, we all know that there are individuals who unfortunately can have issues with addiction related to alcohol. So one just needs to be very sensitive about that. And again, not push drinks on family members, just as one should not push food on family members, and just give people space to eat and drink in a way that's comfortable for them.
All right, let's talk about fatty liver disease. What is it?
So it is somewhat explained in the name. That is to say that it's a liver that has an excess amount of fat in it. And livers are designed to have some fat in them, but it has always been temporary, meaning that, for example, in 300 years ago at this time of year, I wish my liver would have fat in it because we're going into winter. But by the time we came out of winter, the liver would be lean and the fat would have been used up over the winter. So that sort of, on and off cycles were what has always happened and is fine. The trouble is that many people carry excess fat for decades, and that really causes a lot of stress on the liver and actually causes scarring. So this is cirrhosis, basically. And most people are familiar with cirrhosis, likely from alcohol. But now fatty liver disease is the most common cause of cirrhosis.
Is fatty liver disease something that you pick up in a routine physical with blood work?
One can pick it up in routine blood work, but it's not very sensitive, meaning that although some cases might be picked up with routine blood work, unfortunately, many cases are missed.
So, how should a person monitor themselves, or how do they know if they're on that verge of having fatty liver disease?
So unfortunately, we really do have a gap in our ability to diagnose this early on, and that's just a gap. I mean, we can do complex things, but obviously we can't do complex things to large numbers of people. One thing I would just share is that the extra weight that we're speaking about doesn't need to be extremely high. I think many people are familiar with the BMI concept or body mass index. So typically it's around 31 or 32. So that might just be somebody who's 20, 25 pounds overweight. It's not necessarily somebody who is 50, 60, 80 pounds overweight. So I think just to be aware of that, if someone is 20, 30 pounds overweight, particularly if they have any other health issues like diabetes or high blood pressure, then I would just start off with a conversation with your primary care doctor.
All right, let's talk about some other digestive issues. What are the most common types that you treat?
So, I mean, my clinical practice, focuses more on liver disease and weight management. Of course, other issues that are common around this time are issues related to reflux and heartburn, which is not my specialty, but this is something that, as you might expect, is common whenever we overindulge.
All right. What about, let's go back to weight loss. We touched on the GLP-1 drugs, but how important is weight loss in using these new tools?
So these new tools have been revolutionary. I mean, really, when people go back and study this time what's happened over the last 5 years, and I would really encourage people to not think of them really as just weight loss drugs. I mean, that's obviously what's picked up, people have picked up and has sort of gained the most traction in some ways. But even if they didn't induce any weight loss whatsoever. These drugs are extremely revolutionary drugs in terms of improving diabetes, in terms of reducing risk of heart attack and stroke. They're the first drugs that are available for treating sleep apnea. There has been no
Wow.
no previous drug approved for sleep apnea, and also they are a very effective drug for treating fatty liver disease. So they do so much, and we can all imagine that if these drugs did not result in any weight loss, even if that were the case, these would still be historically important drugs.
That's amazing for you to hear, revolutionary. And then you touch on all of those benefits. All right. How is access getting better for patients?
So, as you know, access to drugs in terms of payer access is complex. So, in terms of simply availability, that has improved dramatically in the last year. There were definitely periods when there was simply not enough medication available. So that phase is over. But obviously, coverage for these medications still tends to be complex and definitely not ideal.
And, doctor, where are we in the pill form? I know a lot of people have been waiting for that for years, and that could really be a game changer as well.
Yes, this is an active area of clinical research, and there are other drugs which basically press exactly the same buttons inside the body as the injectables that we are familiar with. It's just that the effectiveness is at the moment significantly below that of the injectables. So, the injectables at the moment are sort of hovering around 20% weight loss, and the pill forms are hovering around half of that. So, not to undermine what they're doing, I mean, 10% weight loss is still a significant amount of weight loss, and many people would benefit from that. But that's currently where they are, at roughly half or slightly more than half the effectiveness of the injectables.
I'm hearing some people talk about microdosing, and on social media. Is that a real thing?
Well, it's a real thing in the sense that people are doing it, you know. So, but obviously these are not, supplements. I mean, these are potent medications. And is it possible that microdosing might be effective for some types of clinical areas? It's possible, but it would need to be tested. So, as we test anything else, there would have to be clinical trials, with careful monitoring of safety and effectiveness. So, I would definitely not recommend anybody to undertake microdosing. The most likely thing that will happen is nothing at the moment, I would suggest. If they were to microdose, they'll, as the name would suggest, they're taking two small an amount of drug, and they're probably still paying something for it. So essentially, the most likely consequence of microdosing is just they're wasting their money.
All right, Dr. Wajahat Mihal, thank you so much for joining us from Yale Medicine. We appreciate your expertise and this holiday season, and we hope you have a lovely one.
You too. Happy
Thank
Thanksgiving.
you.
Bye bye.
All right, we continue on this Medical Monday with Dr. Andrea Halim. She is with Yale Medicine. She is an orthopedics and rehabilitation hand surgeon. So her specialty is hands, and we're talking about what happens to hands during the holiday season. So, Doctor, welcome and thank you for being with us.
Thank you for having me.
All right, tell us all about what happens to the hands during the holidays.
So, on Thanksgiving, everybody invites their families to join them in the kitchen, which is wonderful. But I do see a lot of patients who come in with kitchen accidents. So, there are a couple of things that I always tell my patients to look out for during this time. So, one thing that I've seen recently is a lot of injuries from mandolins. As the viewers may know, mandolins are devices that are used to make very thin slices of vegetables and potatoes in particular. And they can also make very thin slices of fingertips. So I see a lot of patients come in with fingertip injuries, either from mandolins or from slicing things like onions or other vegetables. And I always warn people to be very careful, particularly using mandolins. They all come with a protector, which is a little plastic guide that you can use instead of your fingers to push that vegetable through the slicer. I highly recommend using that.
Is that like a cheese grater? I'm not a big chef, so.
Um, it's uh, it's like a cheese grater, exactly. It has a very thin blade and a little platform that you push down, and then you push the vegetable over it repeatedly
Ah, okay.
in slices. But if you use your fingers instead of the guide and you push your fingertip through that slicer, I see a lot of injuries related to that.
Wow. And what do you do for the finger? Are you able to restore it or just fix it?
So luckily, the hand is actually it's a very plastic organ, and it has very good blood flow. So most of the time, fingertip injuries can be treated conservatively. We do dressings, but they're very stressful for patients because fingertips bleed
Yes.
quite a bit. And so kind of managing that in the acute period is usually dressing changes and reassurance that the finger's going to do just fine. But they're very stressful for patients who are there to celebrate the holiday.
What about carving electric? I know we used to bring out an electric knife. That was Granny's. What are those kind of injuries that you see?
Yeah, absolutely. We definitely see injuries related to knives and electric knives. One of my actually worst holiday injuries that I've seen was someone who used a box cutter to open a gift on Christmas Day. So, if
Oh,
holidays are coming up, I would just say don't have your kids use box cutters to open gifts on Christmas. Also, don't have your any of your family members use one. So that can also be something that comes up. Oop, sorry about my dog there.
that's I love it. He's very, very handsome. Yeah, my husband loves to bring out a box cutter, and that is a really good reminder. Was the injury to an adult or a child?
I was a teenager.
They were anxious. Yeah. All right. What else?
Um, Other things. Well, when the holidays come up, a lot of people like to have their kids jump into the kitchen and help out. I always recommend using
Mm,
they make these safety knives, so plastic knives for kids if you're going to have your kids come help in the kitchen. The most common kitchen injuries I see around Thanksgiving and other holidays are related to slicing avocados and actually frozen meat. Um, Avocados, they're very soft and smooth. And so often, as people are trying to cut them with a regular knife, they will kind of go right around that avocado seed and stab themselves in the hand or the finger. So I see a lot of those. And then similarly, frozen meat is one that I see probably more than any other kitchen injury. So related to trying to separate the frozen meat from the the other pieces of the meat or the package that it's in. That usually takes quite a bit of force. Anytime we're using a sharp kitchen instrument with force, that can go awry. So I highly recommend thaw your meat carefully before you try to separate it or get it ready to cook.
that's interesting. Okay. Any other kitchen or holiday related things that you can think of before we get into winter dangers?
Yeah, so the other thing that comes up quite a bit is related to washing dishes. So if you want a reason not to wash dishes on Thanksgiving, it's because you don't want to hurt yourself. I have had quite a number of patients come in who break either a ceramic plate or a glass while washing it. And that also leads to injuries. So particularly if you're celebrating, you're talking to a family member, you're having a good time, just be very careful when you're washing dishes. Certainly a broken plate or glass can cause a significant injury to a finger.
Oh, and as you said, they do bleed a lot. So, on top of that, all right, let's talk about winter dangers too. As we get into, we haven't had really any snow in Connecticut yet, but as the snow starts to fall, what are the winter hand injuries that you see most?
Yeah, you brought up snow blowers earlier, and that
Yeah.
is something that I always tell patients about as the winter is approaching and as snowy season is coming. One thing that commonly happens is that as people are snow blowing their driveway, that snow blower can get clogged with ice, with rock, with branches, anything like that. That clog will often cause the snow blower to stop. The innocent person will then unplug their snowblower, turn it off, and think that they're safe. But unfortunately, the torque built up in the blades mean that if you put your hand in there to declog your snowblower, that torque will cause the blades to move, and you can get very significant, devastating injuries to the hand. So that's another one that I always tell people to look out for. Most snowblowers come with a safety stick, and that is what should be used.
Oh, so I get it. Even if you unplug it and you think I'm safe, I can reach right in there, but it's stuck and then it undone. Yes, I see what you mean. What kinds of injuries? Do people lose fingers? Do they lose their whole hand?
I have not seen anyone lose their whole hand. It is typically pretty devastating injuries to the finger. So if you can imagine the damage that very powerful blades can do to fingers, it can be tendon injuries, it can be fractures, often open fractures, sort of complex injuries that will sometimes lead to finger amputations, partial amputations, or kind of significant long-term problems.
What about wood splitters? We have a family friend that had a very bad accident.
Yeah, wood splitters are another one. I haven't had a wood splitter injury in a year or two, but every year there's a couple people who come in with these. Wood splitter injuries will usually be partial finger amputations most commonly, and some of those can be reattached and some of them cannot. So certainly using a wood splitter another time to use real caution. Um, Also, as temperatures drop, frostbite is occasionally something that we see. This unfortunately is something that will often happen to people who are experiencing homelessness, but it can happen to anyone. Frostbite is a really unfortunate and difficult injury to manage. I always recommend to people who know that they're going to be outside for periods of time having glove warmers, and there are actually rechargeable glove warmers on the market these days. So
Really?
it's a good thing to have handy in the winter.
Okay, we have 1 minute left. The signs of frostbite. When should you worry?
When your fingers are turning color and they're not pinking up again, significant pain. Um, Certainly blistering is a late effect, but that once you get blistering, that there's usually pretty significant soft tissue damage that's happened.
Well, Dr. Andrea Halim, thank you so much for being here with us. Excellent advice, and we hope that the holidays are quiet in the ER this year. We thank you for all this expert advice because we don't want to end up as your patient, no offense, but
Absolutely, nobody wants to spend their Thanksgiving or Christmas in the emergency room when they could be spending it with their family. So I advise all of your viewers to use caution and thank you for having me.
all right. Thank you, doctor.